We're live from WLNC 2016 in Shanghai, and it's my pleasure to have Gary Duckwile from Los Angeles, United States, for an interview today. Gary, this is a report. The main idea of this interview is to discuss with you the value of the education that meetings like WLNC bring. More specifically, how do you see in the United States the live courses and as part of education for our neurointerventionalists?
Well, I think there is some controversy over the ethical issues. Having the cameras in the room, some people might consider intrusive. Well, at UCLA, we've had a long history of people visiting us, so there are multiple people already there. So my personal view is that so long as the operator is allowed to concentrate and give their full attention to the patient and to the care of the patient, then having people stand behind or outside the room observing, or having a camera do that, to me is really not too different. I think that does, though, there are some operators who really want control, and having anything extraneous in the room disturbs them and may cause an issue. So it's related to some personal preference, I think.
Yeah. If you look then from the side of the from the education standpoint, so if you're in the audience of a course like this, what do you think is the value of receiving this versus the education that normally we have? And I think that this would apply for beginners and then perhaps as an advanced course. How do you think this perhaps fits on that, taking aside all the ethics and but the content and how these courses are made in terms of the value for the education of beginners and perhaps more advanced?
Well, certainly, I think for any level, seeing how somebody else operates and the individual practice they have, even as much as how they prepare their setup, how their hands work, where their hand position is, that's instructive for anybody at any level. And the nice thing, as you're watching a live course, you're looking at that, you have the opportunity with a tremendous panel of experts to add their individual flavor to the technical aspects and to the selection process of what you might use, why you might or might not do a case. So having that for experts is particularly valuable, and for beginners, having the understanding that you have multiple options, multiple possibilities, and understanding that you're seeing some of the best of the best of the best performing these procedures, it allows you to understand the edges of where you go, maybe not the start of where you go.
And I think if you look at this morning's session, we'll pick a case. I mean, what was the case that you enjoyed, that you thought was a valuable case for this morning's session?
Well, as I said, I like to watch the small things, and that may be in part related to the my level. But the second case, where the complicated middle cerebral artery aneurysm, that was, I think, particularly challenging technically to advance the system and get it there. So looking at Saru and his manipulation and the back and forth, I've been in that situation. To see how somebody else handles that was quite useful.
And I think that we came out with a few tips from that. Actually, we had mentioned more distal placement of the microcatheter for perhaps having more leverage to straighten the system, as well as much support for access. All those were important tips that were discussed. I think that he had to deal with a stenosis afterwards too, and so the discussion of angioplasty post was, and you brought up this issue of doing, perhaps in that situation when the device is not fully opposed, to do a Dyna CT or a Vaso CT to kind of further understand the anatomy and where that pinch area is located in relation to the vessel, to then decide on your next move at that point, to angioplasty or not. So I thought those are great points, and I think that if I had to repeat a case like this, do you think that the device, the choice of flow diverter was the best, or would you have picked a different flow diverter for that type of problem, or a different strategy at all?
Well, I think with that particular case, I think there was some variance of opinion on whether or not that case should have been done.
Yeah.
But presupposing it was decided to do it, I think that the use of the pipeline flex, I thought, was preferred, in that the number of curves, the difficulty pushing is harder on that particular case, but you're less worried about having to manipulate the stent once it's there. So getting very far distal with the catheter and being able to pull back so you have enough room so that you can straighten and then deploy, straighten and then deploy, I think were very critical issues, and I have really no argument over the choice of stent. I think it was the right one to use.
Yeah, you're going to be hosting WLNC in Los Angeles next year, and what we should expect about that meeting? What are your thoughts as you see this that we can bring to the United States?
Well, first, I hope that we're able to uphold the high level that is achieved with this conference and all the conferences that you've done. So that's first. It's on me and my team and Los Angeles to present a high level conference like I see right here. But I think that, as you said in one of the cases, in that particular case, the MCA, about the choice and how the difference exists in each country about the options for treatment or not treatment. I think that doing that case, we would probably have a variance of opinion by country on whether that should be done. A lot of the cases today were middle cerebral aneurysms, very interesting topic, and how that falls out for surgery versus interventional in the U.S. So I think that some of our practice patterns may be a little bit different, and that may be a little bit different flavor. Yeah,
I think that's a great point, because as a world meeting, it's extremely challenging because you will be hosting different parts of the world, but the practices are different. But we are focusing on education to every member of our community. The only issue, though, is that if you're hosting a particular country, you will have some flavor of that country or that site. And I think that we certainly in the United States, we're looking forward to have certainly the point of view of the panelists and the discussants. A lot of times will influence a bit how the discussions are. And but I think that the expectation to go up there when we announced that, everybody is very excited. So we're looking forward, and you're going to be a great host, I'm sure.
Right.
And
I hope so.
Well, thank you so much for giving me the time for this interview, and thank you for your attention. This is an interview that will be posted on the Neurovascular Exchange website. Thank you for your attention.